Hello, I'm Dr. Pamela Ruegg. I am fortunate to be the inaugural holder of the David J. Ellis Chair in Antimicrobial Resistance and Large Animal Clinical Sciences in the College of Veterinary Medicine. Some of you may remember Dr. Ellis as he was an esteemed veterinary practitioner who had a big impact on the swine industry in the state. And I'm proud to tell you he was one of my teachers when I was a student here. So today I'm going to be talking about a very important and practical subject today that is influencing all of our animal commodities, and that's the subject of antimicrobial stewardship on our farms. All right, the subject of my talk today is how we in animal agriculture can actually benefit from antimicrobial stewardship programs. And this is a little bit different take on this because I think we often look at these antimicrobial stewardship programs as something that's being imposed on us. But I'd like everybody just to maybe suspend that thought for a minute and think about the good that can happen when we in animal ag engage in these programs. You know, one of the things that is very true, regardless of which type of animal protein we're producing today, is that consumers get competing messages about antibiotic usage in animal agriculture. You just look at these two slides, these two pictures, these two pieces of news that I'm got up today. One on your left is a report from the Center for Infectious Disease Research and Policy, which, you know, who really knows who that is? And it says, U.S. pigs consume nearly as many antibiotics as people do. That's one message that gets transmitted. And then on the other side is a message in the National Hog Farmer that says, U.S. pork producers are committed to responsible antibiotic use daily. And both of these messages are messages which are competing for space within our consumers. I'm going to be referring, you know, I work primarily in the dairy industry, but the issues in the dairy industry and swine and all of animal ag are the same. And I'm going to show you a little bit of data from the dairy industry as well. This is from a study we published this year called Quantification of Antimicrobial Usage in Adult Cows and Pre-weaned Calves. And this is quantification across 40 large Wisconsin dairy farms. What this graph shows is on the horizontal axis, we've got 40 farms, data from 40 farms. And on the vertical axis is the average daily dose per 1,000 animal days of antibiotic used. And it's not important that you understand the metric. What I want you to take a look at here is the tremendous variation. Our lowest using farm, this farm that I've labeled number 1, used about 5 defined daily doses per 1,000 animal days, whereas our farm number 40 used approximately 40 animal daily doses per 1,000 animal days. And we see this kind of large variation among farms regardless of commodity. And part of the reason we see this variation is not many of us have a good context for what normal antibiotic usage is. And the same thing applies to measures that have been done in the swine industry. Lots of variation. This is kind of a messy slide, but this is a study that's titled Variation in Use of Antibiotics Among Swine Farms in 2016 and 17. It came out in 2020 with Davies and Singer. And you really don't have to understand the details of this. You just need to look at kind of the pictures. Let's look at 2016. Those colors are all different types of antibiotics. And let's just contrast Farm A and Farm C. You can see Farm A used 70% of their usage was tetracycline. Farm C, approximately 35% was. Farm D, almost 90%. This isn't volume, but it just shows you how much variation there is in usage among farms. And this is reminds me of very early in my career when we were trying to figure out some of our other metrics, like what's the right amount of certain diseases. We had to start collecting this data, understanding it, and trying to understand what was achievable before we could make progress. And I think the same thing applies to our use of antibiotics. And when we start understanding and benchmarking this data, then at some point we'll be able to, on individual farms, make decisions about, hey, do we need to work on certain areas of improving antibiotic usage? Okay, so with that background of all this variation that we see out there in farms, I want to just introduce the subject of what is antimicrobial stewardship. And just all commodities right now, in response to these societal pressures, have statements about what antimicrobial stewardship is and why those of us producing animal protein are interested in it. And the National Pork Board has a policy on antibiotic usage in pork production, and I'm sure many of you are familiar with this. And these statements are very similar. They say things about using antibiotics responsibly, prevention of disease, reducing the use of medically important antimicrobials, and following guidelines to make sure that antimicrobial usage or antibiotic usage on farms is done in a responsible manner. So this is some of the pork producers. We agree to implement the following guidelines to demonstrate our values: advocating objective, scientifically rigorous studies and risk assessments, engaging with veterinary oversight, promoting stakeholder education, demonstrating compliance with regulatory requirements and treatment records such as in PQA+, and encouraging transparency. So these are all really good things, and I'm really an advocate of these, but I also want to point out that when we start looking at antimicrobial stewardship at the farm level, there's beneficial things for us that actually can improve the efficiency of our agricultural units and the welfare of our animals. And you see this a little bit in the American Association of Bovine Practitioners definition of antimicrobial stewardship, which says that they're committed to reducing the need for antimicrobial drugs by preventing infectious disease, and when antimicrobial drugs are needed, using them in an optimal way. And the thing I kind of like is that this antimicrobial stewardship is introduced as a cycle of bacterial disease management. And that's where I think we need to be moving toward, is kind of just incorporating the fact we need to diagnose our bacterial disease, think about non-antibiotic alternatives. When we do have to use antimicrobials, think about the least amount we need to use. And then after we're finishing up with our disease management, our bacterial disease management, reevaluating the need for antimicrobials in future cases. That's a little bit different spin on it, because now we're moving directly in, are we optimally managing bacterial diseases? That's a really important concept for us to understand. Antibiotics are for bacterial diseases, and they help the animal's immune response successfully eliminate bacterial pathogens. And so when we think about antibiotics, we should be thinking about bacterial diseases. And when we think also about the value of antibiotics, we have to understand that the value of that antibiotic is the marginal difference between the spontaneous cure rate and the treatment cure rate. So let's just take a look at this little graph I've put up here to illustrate this. So let's say we have a viral disease, and you can see this green bar. Antibiotics don't help at all. So if we have 100 animals affected with a viral disease, and 50% of the time the animal's immune response can effectively eradicate that, the spontaneous cure rate itself is what is helping that animal. Now let's move into bacterial disease A. We've got bacterial disease A, which is the middle one here, where we've got 50% spontaneous cure, and we're going to use an antibiotic that has 50% efficacy. And that's the other important thing to understand. Antibiotics themselves rarely have 100% efficacy. So if we treat 100 animals and 75 of them get better, 50 of those were spontaneous cure, and the antibiotic actually cured 25. What we see as cure is the combined amount of the spontaneous cure plus the treatment cure. So it's important for us to understand which bacterial diseases can respond to the antibiotic and which bacterial diseases can't, and which bacterial diseases have high spontaneous cure rates if the other animals are otherwise immunologically competent. And these are the things you need to be working with your veterinarian on and achieving bacterial diagnoses. So one of the things I want to introduce today is the concept that we need to do a better job of measuring antimicrobial usage, because if we don't measure it, we can't manage it. And this article that I'm showing you here is an article called Antimicrobial Use in Weaned to Market Pigs in the United States, assessed via voluntary sharing of proprietary data. And this is a fairly recent article that came out in this last year by Davies and Singer. And what you're seeing across the horizontal axis is individual farms labeled with A, B, C, D, E, and F. And then the vertical axis is simply showing the proportion of antibiotic usage on these farms that is critically important, highly important, or not important. And this critically important category, these are the drugs that the FDA and the World Health Organization has said, hey, we need to reserve the use of these for human diseases when possible. And you can see that in this data, on just these few farms, Farm C, about almost 50% of their antibiotic usage is these critically important antimicrobials. They probably don't know this. They probably don't know that they're using more than other farms because we haven't done enough benchmarking. And so we have to start thinking about this antimicrobial stewardship management cycle. On our farms, benchmark and assess the usage of our antibiotics, develop farm-specific goals for usage, assign actions to members of the farm treatment team to reach those goals, and then assess the results of actions. So I'm proposing we move from antimicrobial stewardship as something that's imposed upon us that we have to reduce antimicrobial usage into a management cycle where we're looking at understanding how and why we're using antibiotics, and then ways to optimize that use to ensure the welfare of the animals we're dealing with. So to do that, we have to understand the different types of antimicrobial usage. The easiest to defend and the one we need the most is therapeutic usage, and that's treatment of disease. So that would be, for example, treatment of pigs showing signs of respiratory disease. And then the prophylactic and the metaphylactic, they kind of merge together a little bit. Prophylactic usage is the treatment of antibiotics for prevention of disease. That would be, for example, if you treat pigs in the same pen with other ill pigs. And then this metaphylactic usage, this is often the most problematic from the consumer side, where we're using antibiotics to minimize the effects of an expected outbreak. And that would be, for example, if we treat pigs housed in the same building with ill pigs. And if you look at this NOMS data, you can see that this metaphylactic use, treat all pigs in an entire room with clinically ill pigs, is pretty common. About 50% of farms do that. And that's one of them that's the hardest to justify when we think about judicious usage of antimicrobials. So there's some criteria for justifiable antibiotic usage, and these criteria are listed here. And this is from a book called Antimicrobial Stewardship in Animals, or from a chapter in a book. So here's the 6 criteria we need to think about. We need to have the local veterinarians developing and assessing protocols. We need to make sure animals are examined before antibiotics are used. That's coming back to, is this a bacterial disease that requires the use of antibiotics to achieve cure? So there should be a reasonable benefit that a bacterial infection is present. We should target that bacterial infection with the narrowest spectrum drugs. We should use as short a duration as possible. That's one that in my career, we've gone from short to long, back to short duration recommendations, and we should avoid extra label usage when possible. So let me just spend the next maybe 5 minutes to conclude here, talking about some practical ways to do that. And that's the 5R principles of stewardship. Responsibility, we need to have a treatment team who's engaged. Reduction, we need to have focus on preventive practices. Replacement, are there things other than antimicrobial usage that we can do? Refinement, we want to evaluate the quality of antimicrobial usage and review, monitor the outcomes of those treatments. So assessing quality of antimicrobial usage, want to make sure we're treating bacterial infections. We want to make sure that we're following approved protocol that the local vet is engaged in, and that we're using the right dosage, duration, and route. So putting this into action, responsibility and leadership, our goal is to create accountability. We can do that by regular training of an approved treatment team, prescription and drug purchase process review, and assessment of a recording system. The benefit for the farm is increased competency of employees and a defined chain of command for animal health decisions. Secondly, how about reduction in need for antibiotics? Our goal, and this is a common goal on virtually all farms, is to prevent bacterial diseases. Our actions are to determine the incidence of the most common, let's say the big 5 bacterial diseases, and review your detection, diagnosis, and recording criteria. Then make an action plan focused on one disease. Our benefit is to reduce disease rates and increase production efficiency. Third, replacement. Our goal is to use non-antimicrobial interventions when possible. So let's reevaluate and re-examine our vaccination programs. Let's consider non-antimicrobial interventions when we have chronic diseases. And our benefit is reduced morbidity and mortality losses. Refinements number 4, and that's to improve our quality of antibiotic usage. So we need to read the labels of the antibiotics. We need to evaluate the diagnostic criteria for bacterial diseases, review our antibiotic choices, and evaluate our rationale for duration. Our benefit is we're going to preserve the efficiency and efficacy of antibiotics used on your farms. And we're going to reduce usage probably of those critically important and medically important antimicrobials. And then finally, we need to review. Are our current treatment protocols effective? We define the outcomes, evaluate the costs, benchmark usage. If you've got multiple farms, compare them, address why there's higher use on some farms than others, and we're going to come out with better treatment results. So to conclude, antimicrobial stewardship simply means better management of bacterial diseases. It's good for the farm. It's similar to the other things that we do to make incremental improvement. We've got to have benchmarking, goals, actions, and assess our results. Thank you.